You know what? There's a love that cannot lie. Never with joyful giving. There's peace we cannot feel. It's the last time love enough is woman.
Amanda, before I start, in the face of God, we are all equal. And according to the Constitution, we are all equal. All these titles that we have in this world are man-made. So allow me to say all of us here, we are comrades, and I will continue calling us as comrades.
Kaofela pela sefatlhego sa modimo re a lekana le molao re a lekana jwale ntumileng go seng ga letsatsi ke tlo di bitsa kaofela macomrade gobane kaofela macomrade.
So before we start,
pele ga re tla qala
I'm not good at singing, but I would like us to sing the national anthem. There is Nkosi Sikelel' Africa. There is a national anthem. I don't know which one do you want to sing, because Nkosi Sikelel' Africa does not have Uti stem, but the national anthem does have Uti stem.
go na le national anthem ga ke tsebe o bina fela ke rata re ka e bina ga ke tsebe na ke batla o bina efeng Nkosi Sikelel' kapa national anthem e nang le di-stem.
So can someone lead us on national anthem with Uti stem so that we can accommodate everyone?
go na le motho ya tla re qalla national anthem e nang le di-stem gore re tsebe go accommodate mang le mang.
Nkosi Sikelel' Africa, malipata isuperayo, izayibutakaze yetu. Nkosi Sikelel' Thank you very much, comrades. Comrades, mine is not too long.
Welcome to the comrade. How many?
My name is Anele Yawa. I'm the General Secretary of Treatment Action Campaign.
Treatment Action Campaign.
And I don't have a medical aid. I don't use a private hospital. I'm a public health user.
Hagina medical aid, ibi like services sepetlele, se sebediswa ke batho ba medical aid ke motho wa sepetlele sa public.
As one of those people who are experiencing on daily basis frustrations of and the failures of the public healthcare system.
Jwale ke mo wa batho le nna ya ile mona ke tseba ebile ke utlwisisa ho sa sebedisa le mo ha dipetlele tsa rona tsa public.
Before I can proceed, comrades, this morning I received an email.
Email.
And because of that, I will read this email. After reading this email, I will humbly request all of us to stand up, all the male comrades, to take off their heads and give a moment of silence. But let me read first.
Ka baka leo ke tla bala email ena ke ha eba ha ke qotile ke kope batho ba bontate kaofela ba eme ka maoto ba role dikatiba tsa bona re nke motsotso wa khutso.
The email which I'm going to read for you is coming from the TAC branch in Tabanchu.
Email ke tlo bala yona e tswa branching that is
it's up. Okay, let me read it this way. Thabo Modimole is a member of TAC in Tabanchu branch.
Thabo Modimole ke o mong wa maloko a TAC branch ya Tabanchu.
And 2 weeks ago, he was admitted at Dr. Moroka Hospital
Dr. Moroka Hospital
because he felt sick and was in pains all over the body. At the hospital, they took a chest X-ray, and it showed that both lungs were swollen. They couldn't test him for HIV as there were no test kits in the hospital.
HIV test equipment in a test for HIV.
He was always in pain, and he has not been given anything to ease the pain, as there was no medication, even the painkillers to stop out. A nurse who wanted to remain anonymous told TAC branch chairperson
branch manager at TAC
that there is no medication in the hospital. Eventually, he was tested last week, Tuesday, on the 30th of June 2015.
We are tested again 30th June 2015
for HIV, and they used an ELISA test.
For HIV,
Unfortunately, he passed away last week, Friday, the 3rd of July. We're waiting for both to identify the cause of the death. He passed away while waiting for his HIV test results, which they were supposed to be given to him on Tuesday, 7th of July. Only if resources were available in Moroka Hospital, his life should have been saved. But he stayed in the hospital for 2 weeks without being given any medication. They didn't diagnose him because there were no equipment to do so.
Even
Even when he was suffering from pain, no pills for no medication for pains was given to him. His family is still mourning and preparing for his funeral. In honor of Utabo, I will humbly ask all of us to rise and give a moment of silence. I told you, we may be seated, comrades. Firstly, comrades and friends, let me take this opportunity to thank all of you who are here today. Firstly, let me thank comrade Utembeka Gwagwa, comrade Reverend Paul Gay, comrade Reverend Paul Gay, comrade Utoko Madongo, comrade Toko Madongo, and our driver. Also, let me acknowledge that amongst us we've got Love Life, Love Life, we've got RAP, PRA, ACGP, DA, UGM, FF+, Free State DOH, Free State Department of Health. Today, comrades and friends, we are gathered here. We are gathered here with people from different districts and communities of Free State. About a month ago, TAC comrades in all these districts and branches, they had community dialogues. Where we engaged with communities around some of the issues which affect them with regards to the public healthcare system and how the public healthcare system is failing our people. Free State health system To be honest with you, our work in Free State started around 2008. So it was not for the first time, it was the continuation of the work that we had started with the communities of Free State. Most of them are TAC members, most of them are public healthcare users, most of them are people living with HIV and AIDS, people with tuberculosis. In 2008, HIV and AIDS, for political reasons, TAC has been accused of being a political party, working with political parties. TAC has been accused of paying people to tell lies. And because of that, we have decided to have a People's Commission of Inquiry with an independent commissioners who are going to listen from communities when they are telling their stories, testifying how good or how bad is the public healthcare systems from where they come from.
Mme ka lebaka leo re tlile qoto ya le commission ena ya TAC mo re nang le independent panel e tlo mamelang ditletlebo le ditori tsa rona batswadi.
As TAC, we have facilitated this process, but we don't own it.
Re le TAC ke rona re etelletseng project ena pele empa ha se rona re owner.
The only people who are going to own this process is the communities and the commission.
Batho ba tshwereng project ena kapa facility ena ke lona batho ba dutseng mona le panel e dutseng mona tafoleng.
The commission stories, they will ask you questions, they will write down everything.
Ba tlo le botsa dipotso ba mmele ditori tsa rona mme ntho nngwe le nngwe ba ingole fatshe.
After getting all your stories, in the next 2 days, they will write the report, applying their independent minds, and they will give the report to everybody, including TAC, government, provincial, national, and other institutions of government.
Mme ka mora matsatsi ana mabedi ba tlo ngola report ha ba qeta ho utlwa ditori tsa lena ba tlo ngola report e fiwe motho le mong mme e fiwe government ho tloha local government ho fihlela provincial.
We are aware that some of the communities here and some of the individuals that are here, they have written their testimonies, and we humbly ask that if is there anyone in this hall who feels that he or she has a story to tell about the success or the failures of the public healthcare system. We've got Ruta on that side, we've got Ukombe Violet here. You can just go to them and make a request for your own submission.
Mme re lemohile hore ho na le batho ba ngotseng testimony tsa bona fatshe ha ele bana le kgahleho ya ho tlo bua ba tlo testify ba ka isa ho loti ya dutseng mane le Violet ya dutseng mona.
Without wasting your time, my commissioners and Comrade Violet, allow me to take this 1 minute.
Ntle le ho sietsa nako ma comrade mpeng motsotso ona na fela.
Comrades and friends, we need to understand that as TAC, our struggles are informed by the struggle for the liberation of this country.
Re hloka ho tseba ma comrade hore struggle sa rona re le TAC se liberatiwa ke struggle sa country sa motse o re phelang ka rona.
We are the products of the liberation struggle of our country, and we have voted for our government. We are not enemies to our government. We are a social movement guided by the constitution of this country.
Re batho ba tsebang hantle strike se sa rona sa naha ebile ke rona batho ba votelang mekgatlo ena e mengata.
The majority of our comrades are voters of this government.
Bongata ba ma-community a rona ke bona batho ba votelang mokgatlo o eteletseng naha ya rona pele ebile ke bona batho ba votetseng government ya rona.
And it is a lie to say that TAC is going around communities paying people to tell lies. Because if we had that money, we could have paid for each and everyone that is here. The money that we had for this commission, it was the donations from different organizations. In Free State, we've got only 3 people who are in the TAC payroll. All other people are the volunteers of TAC. So, in those few words, comrades, it is a lie to say that TAC is working with political parties or any other political party. We are not affiliated to any political party in South Africa or anywhere in the world. However, we engage on political issues. Because health issues are political.
hobane ditaba tsa health ke tsa political issues.
And they need political intervention.
Mme di hloka hore sepolotiki se kene ka hare.
And as TAC, as activists, we are not scared to speak truth to power and defend our constitution of South Africa as it was enacted in 1996.
Mme le TAC ha re tshabe hore re ka engage mme re lwanele constitution ya rona jwalo ka ile ya tiswa ka 1996.
Because the liberation struggle of South Africa has taught us that freedom or death, but victory is certain.
Hobane struggle ho lwana kapa freedom empa se se tswela pele.
With those few words, I thank you.
Ka mantswe a ke a leboha.
Thank you very much, Comrade Anele.
Ke leboha.
Is Violet, as the comrade already introduced me. Okay. Before we start, just a few housekeeping issues.
Pele re ka qala melaonyana ya housekeeping.
So if anybody wants to leave the room, you can use this particular door. We're not going to be using the door behind the panel.
Haeba hona le motho a batlang ho tswa go sebedisa le matrina mme le nele ka mora panel ha le sebetse.
And the bathrooms, if you get out of this door, you turn right, go through the double doors, and then you take the first right. You find the bathrooms on that side.
Mme ha o batla ya toilet o tswa ka le matrina o ya tlase o kena right ya pele o tla kopana le tsona ka right.
Okay. And this particular commission is going to run in 3 sessions.
Commissioner rona e tsamaya ka mekgatlo e meraro.
The first session will be from 9 till 11.
Ile session ya rona pele re qala ka 9 fihlela ka 11.
And the break will be from 11 till 11:30.
11 fihlela ka past 11 tla ba break ba tee.
And the second session will be from 11:30 till 1:30.
Session ya rona bobedi tla qala ka past 11 until 1:30.
And lunch from 1:30 till 2:30.
Ile lunch e tla ba ka 1:30 fihlela ka 2:30.
And then we'll continue from there at 2:30 till 5:15.
Ile re tla qala hape ka 2:30 ho fihlela ka 5:00.
Food will be served outside and you're welcome to bring it in.
Dijo di tla be di le ka ntle mme le amohele hore le ka kena ka hare ka tsona ntho jwalo ka hare.
Thank you.
Ke lebohile.
So what we're going to do, how we're going to start, we're going to invite different communities, and then the community will invite will sit in the front row.
Re tlo bitsa metsi e fapafapaneng mme ha re bitsa motho ka tla tlo dula ka pele.
Okay. And then we're going to call up the person to testify, and they'll testify from where they're seated.
Ebe re bitsa motho ya tlo fanang ka testimony o tla bua a dutse fatshe.
Okay. Thank you very much.
Ke lebohile.
The first community we're going to start is with Harry Smith, and they've already taken their seats. Is there anybody else from Harry Smith who's sitting at the back?
Hona le batho ba Harry Smith ba bang ba dutseng morao ba tlameha ba tlo testify.
Okay. So as the first person testifies, you give your testimony and then you hand over to the panel.
Ha motho ya pele a qala bua o tla bua mme re tla fa panel e tlo fana ka dipotso.
Okay. Thank you very much.
Ke lebohile.
The first person to give the testimony is Veli Hadebe from Harry Smith.
Motho wa pele ke Veli Hadebe from Harry Smith.
Okay. You may stand up and give your testimony, and once you're done, we'll hand over to the panel who may ask you some questions.
Okay, ena o fana ka bopaki ba hao mme ha o qetile re tla fa panel e botse dipotso.
Thank you. Okay. So some people may not be able to stand. So if you're not able to stand, please feel free to just sit down and give your testimony while you're seated.
Ha ebe o sa kgone ho ema ka maoto hona bothata o ka bua o dutse fatshe.
Thank you.
My name is Veli Hadebe. I'd like to greet everyone in the place.
And
the reason for coming here is to lay complaints regarding our hospital, Tebe. I had a pregnant daughter who was about to give birth in the hospital of Tebe.
Ula kena Thebe, kadi 3 aba asewa.
She was admitted into the hospital on the 3rd and had a C-section.
Baya to abele ha thola ngwana wa ngwanana.
And then she gave birth to a baby girl.
Kadi 4 abanyolo ayam Manapo.
And on the 4th, she was transferred to Manapo.
Kadi 6 aba discharge.
And on the 6th, she was in Sishaka.
Yona ncheklin din ka yona ka bulela ka mora hore a thole ngwana.
What brought me here today is the fact that after she gave birth,
Ula bale ntonyana e motshwarang subeng ya ho khotlekgotlela a ntse a matha sepetlele ntse ke mo isa sepetlele.
she had a problem with coughing and she was taken in and out of hospitals.
Jwale ha ke fihla sepetlele nakong tse ding ke thola bo doctor ba le teng empa mara ba sa kgone ho sebetsa motho ona ke dile yena ho tloela ka 8 mohlomong ho fihlela bo 10 kapa bo 1.
Sometimes I get to the hospital and the patient would sit from 8 to around about 1 every day.
Jwale he ka kopa ho kenya tletlebo mono ba mpha buka e kgolo somo.
And then they gave me a book where I could lay my complaint.
Ka bolela di-complaints tsa ka moo.
And then that's where I jotted down my complaint.
Then le ngwana a ntse a kula jwalo ntse ke mo tsamaisa ho doctor la.
We went to continue and I took her to a doctor called Lucky
Hobane mo la sepetlele bo doctor ba kgone ho tlhaka ya bona ngwana o jowa.
because at the hospital they were not able to explain what the problem was. Because prior to the C-section, she was not sick. It only began after the operation. One day she became sick again.
23 November.
And that was on the 23rd of November. I took her again to the doctor. She got to the doctor, he evaluated her and decided that she needed to be transferred to hospital. And we called an ambulance from the doctor's quarters. The ambulance never arrived. The doctor decided to take the patient to the hospital since that she might even lose her life while waiting for the ambulance. We then took her to the hospital. We got to the hospital and there was a nurse standing behind the van. When I got to the hospital, the nurse ran inside the hospital. I got inside, greeted everyone and asked for the supervisor. I requested for a wheelchair from the car into the hospital. The supervising nurse showed me the wheelchair. I told her that I would not be able to carry the patient alone, that I need assistance. If I was not about to abide by the rules, I should just leave the hospital. I asked for assistance and she said she was busy, and I told her that if she was busy, she should give me something that I should give her to help her breathe. She still maintained that the rules she said were the ones that needed to be listened to, and if you don't listen, you should leave to the other hospital. I left the wheelchair and exited the hospital. When I got outside, she was still on the floor where I left her.
ha ke sa kgona mo nka ke mo isetse ka koloi.
and I wasn't able to take her back into the car.
Jara itse ha ntse ke eme moo ntse ke batla thuso hore nka thuseha ha jwang.
Whilst I was still there looking for help,
Ka thola ho na le banana ba babedi ba tswang ka hara sepetlele ba ke mona Robileng.
3 girls were exiting the hospital, one with a broken leg.
Jara ka re ba nthusa ho mo nka hantle le mo kenye ka koloi.
I asked them to help me carry my daughter back into the car.
Jara ba le ba nthusa hore mo kenya ka koloi. Ka tswa hape ka hara moaho wa sepetlele ka ya hospital.
They helped me and I was able to leave the hospital and drove back to Dr. Lucky.
After Dr. Lucky ka ema he a khona mo nka hape Dr. Lucky mo ke khona mo kenya ka ngakeng ba ha sa khona tsamaya.
I wasn't able to carry her back into the surgery because she just wasn't able to walk.
Ka sheba ka thola ntate Mokwena.
And there was Mr. Mugwe.
A tla ho nna tla nthusa.
He came and offered his hand of help.
A re fihla hala ke ha ona wheelchair. Nka se ke se ke dula ho sona.
There was no wheelchair at the practice, so we had to take a chair. And we carried her in with the chair. He gave her some medication and said that we needed to call an ambulance again, but it never arrived. It was around 11 or 12. Like he said, I should take her back to the hospital. Now with Ntate Mokwena, I took her back to the hospital. I got to the hospital. And the supervisor said, where did you think you were going to end up? This is my hospital. You listen to my rule. And Mr. Mokwena said that he will take over and I should leave. He got the wheelchair and still there was no assistance. We both carried her onto the wheelchair. He pushed her in and luckily a doctor appeared. I don't know what happened whilst the doctor was trying to assist her. When he got back, he said that we should find 5 numbers for the head of the hospital. We got those numbers and called him over. And the sister had run away. The doctor then came to me and asked who the father of the child was. I said, I was the father. He said that we should talk privately. We got into the room and he told me that my daughter had passed on. That's how the story ended.
Okay. I'm now going to hand over to the panel.
Okay, Tate, just ask just few questions so that we make sure that we have understood you properly. Okay, no question for now.
Ha hona dipotso ha jwale. Ke lebohile.
Okay, thank you. We're going to call upon Yvonne Fiana. Yvonne Fiana.
Ngizathanda ukunibingelela nonke phakathi lana. Mina ngu-Yvonne Fiana Ntam from Harrismith.
Ke rata ho dumedisa kaofela sebakeng. Nna ke Yvonne Fiana Cham, ke hlaha Harrismith.
Ngize lana nge-problem yami yenyawo namakliniki neebhedlela.
Ke tlile ka lebaka la bothata ba leeto le ditleliniki tsa Durban. I'm sorry.
Attention please. Ngicela ukunazi ukuthi na ngine-problem yenyawo from 1998.
From 1998,
Ngangena esibhedlele ngenyawo.
I developed a leg problem. I got into hospital.
Abodokotela bathi i-abscess.
Doctors said it was abscess.
And then ngalala esibhedlele for the 1998 November.
And
Ngalala the whole year 1999 yonke. Ngibele esibhedlele.
I spent the entire year of 1999 in the
The whole
hospital. The entire year.
And then ngaphuma esibhedlele ngabuyela eHarrismith bengisemadadeni. Ngabuyela eHarrismith ekliniki. Ngiyaba ngiloku ngiyatreatwa ekliniki. Sometimes uma ngifika ekliniki elisedi ikliniki angitholi treatment yenyawo.
I got out of the hospital and was working with the clinic for the entire year. And sometimes when I got to the clinic, there was no medication.
Kwafikakala ukuthi nginoshukela.
And then it was discovered that I had diabetes.
Ngine-BP.
And then I had high blood pressure.
Kulesikhathi samanje ngine-17 years ngale nyawo.
I've been struggling with this leg for 17 years.
Ngine-4 years ngizithengela i-medication.
And I've been buying my own medication for 4 years.
When I go to the clinic, they told me there's no medical for me. There's no pain block for me. There's no sugar tablets for me. There's no high blood tablets for me. Now at this moment, I'm struggling. I'm getting disability grant, 1,400. I'm using a lot of money for the whole month to buy for myself medication.
Ha ke fihla sepetlele ho thulwe ha ona dipilisi tsa pain, ha ona dipilisi tsa diabetes, mme ha ona dipilisi tse tla thusang leoto la ka. Ke ntse ke ithekela dipilisi dilemo tse 4 tse fetileng.
And then on the 6th of 2015, yes, 6th of 2015, January, February, April, ngaya clinic edrobheni.
On the 6th of April, I went to the clinic in town.
Ngiphethwe yilo inyawo leli lingistrugglisha kakhulu.
And I was still struggling with my foot.
Nginganamali.
And I had no strength.
So, abo sister bathi ngibuye nge-8 za April ngizobona udoktor.
The nurses told me I should come back on the 8th of April to see a doctor.
Ngaya nge-8 za April.
And I went on the 8th.
Uma ngiye clinic njalo, ngicasha imoto, ngibhadala 100 rand.
I had to hire a car and pay an amount of 100 rand in order to be delivered to the hospital.
Udokotela wamcheck. Wachaza wathi ushukela wakho uphakeme too much.
The doctor checked me and told me that my diabetes had escalated.
Understand lapho.
And I understood.
Wathi ngizokutransferela eManapo. iManapo izokutransferela eBloemfontein.
He told me that he was going to transfer me to Manapo, and Manapo would transfer me to Bloemfontein.
Bazobona inyawo ukuthi kuyenza ngalani ngalo cause beselibhede kakhulu.
To be able to evaluate what was happening with the leg.
Till today, I'm still waiting.
Le kajeno ke santse ke eme.
Near 27,
On the 27th
May.
of May,
Yaba ngithumelela umntwana wami eclinic yaselokishini.
I sent my child to the local clinic.
Hambe eclinic uyongicelela amagauze namabandage anginamali yokuthenga.
Go to the clinic and get me some bandages because I wasn't able to buy myself.
Anginamali ye-transport.
I had no transport money.
I can't work.
Ebile ha ke tsebe ho tsamaya.
Ngwana ya clinic ba mo fa bandage tse pedi ba re di gauze yo. He says,
The child was given 3 bandages and there were no gauzes.
Babe bari o jwetse mmao a tle ka di 29. I tlise yena self.
I was told to use one bandage as a gauze and go back to the hospital on the 29th by myself.
Not on the hospital, on the clinic.
To the clinic.
And then after that, near 29, ngaziyisa e clinic ngaqasha imoto.
I hired a car again and went to the clinic on the 29th.
Cause benginenhlungu.
Because I was in excruciating pain.
Ngihlala nginenhlungu ngaso sonke isikhathi.
I'm forever in pain.
Mangifika eclinic bangitshela ukuthi abana legs.
When I got to the clinic,
Abana mapilisi wenhlungu.
they said they had no painkillers.
Ngaqala ngakhala ngathi kodwa ngibizelani ukuza la. Nginganalutho nithi ngizoyenza.
I started crying and asked them why they called me there if they knew that they had nothing.
Right, usisi wamathi ngicela ngibise esibhedlela ngoba ngeke silale njengoba khala kanje.
My sister required that they take me to the hospital because they were not going to be able to sleep.
Okay, banyenzela incwadi, bafonela ambulance bangithumelela esibhedlela.
They wrote me a letter and transferred me to the hospital.
Ngangena esibhedlela eTheku.
I got to Terry Hospital.
Udoctor wangisebenza, wangidlalisa, wathi uyangi-admit.
And I got admitted.
Kodwa wangicela wathi lalela la mama. Bengicabanga ukuthi kusasa ekuseni uhambe uye eManapo bayokunqamula inyawo.
The doctor said that he thought I should be transferred to Manapo Hospital so that my leg could get cut off.
I said no.
And I refused.
God, it's not time for me.
Hobane e ne so ka eba nako.
Modimo ha so dumele.
God hasn't agreed yet.
Andikwelela doctor.
And the doctor let me go.
Karwabala bantreata.
I got treatment.
Tebe hospital is not a hospital. Ki clinic batho ba Modimo. Ha se sepetlele di sister ha di kena. Di kala bebere. Ba bona batho. Ba tlo fihla ho rona ka bo9.
The nurses get to the hospital and they don't operate like the nurses from a hospital, but rather those of a clinic. They only see us at around about 9.
Ha se ba bona ngaka ise ikena.
Once the doctor arrives.
And the hangaka ikena ka hare ka mo ka working ya hao. Ba ayo thatholla loto e batla o sheba leqeba.
All they do when the doctor arrives is unwrap the leg.
Ba go tlohella for 5 hours, 6 hours, 7 hours. Untso duty.
And they leave you unattended for about 7 hours.
Ba tlo qala ho dress at 3 o'clock or 4 o'clock.
And then start,
Sometimes 5 o'clock.
and then start dressing the wound at around 3, 4, or 5.
And that time I tell you that I tlameha ho le fumane mohatse.
And at that time, you can't leave a wound undressed.
Ha ya tlameha ho le dilo di tsotsi.
The wound can't be left undressed.
Ha ke nurse but ke a tseba.
I'm not a nurse, but I'm aware of that.
Ke robetse selemo mental.
I slept.
Matateng.
I was admitted for an entire year in Matateng.
So ke kopa le thuse batho ba Modimo. How monate o phela bophelo boo. Ha kopa dipidisi tsa di-pain, ha diyo.
So please help us, dear people. It's not nice living like this. When you require medication, there's none.
Ha re di sepetlele everything tja.
We treat it like
Wa
that,
qala o re o ya holetsa nurse, thusa mona, ba re ah tloha wena.
and they don't give you any attention when you require their help.
Ha monate batho ba Modimo. Ka tloha ka di-5 tsa June sepetlele.
I was discharged on the 5th of June.
Ngaka e be ngolla lengolo hore ke ye Lesedi clinic
And the doctor gave me a letter to be transferred to the city clinic
hore ba ndresse moo.
so that they can be able to dress my wound.
Unluckily, ke ha ho qala strike moo Harrismith ba itjhisa clinic.
And then the clinic was burnt down due to a strike.
So ka qala ho matha phumulo.
And then I had to go to Indabazo clinic.
Ntse ke matha ka koloi ke a hira.
I'm still hiring that car.
Ha ke ya Indabazo clinic, ba batla hore ke fihle hoseng ka 5.
The clinic wants me to arrive in the morning at 5 a.m.
So ba tlo kgona ho ndressa early.
so that my wound can be able to be
Maybe
dressed
ka
early,
8:30.
maybe around 8:30.
If ke fihlile late moo, mohlomong ka 9,
If I was
ke
to
tlo
get there at 9,
dresswa ka 4.
my wound would be dressed at 4.
Tjhe, re kopa thuso batho ba Modimo. Ha o na le ngaka e ka kgonang ho nthusa, ka leqeba le, please help me.
If there's a
I'm
doctor,
sick and tired.
if there's a doctor that would be able to help me with my wound, please help me.
Ke kgathetse. Ke dula ke opelwa letsatsi le leng le le leng. Le ntse le hona tjena la ntse ke le mona, ntse ke opelwa.
I'm in pain each and every day of my life, including even now.
Ha o monate ho opelwa. Ke dula ke kadimiwa dithupa hore ke tsamaye ka tsona, cause ha ke kgone ho itsamaisa. Sepetlele ba ntjwetsitse hore na ha ba no kgona ho mfa dithupa. Ha se tsaka.
I was
O
even,
kadimiwe.
I was
Ha
even,
ke na
borrowed-
yona 3,000 eo na ya ho tsamaya.
I was even borrowed those crutches because I was told that I needed to buy my own by the hospital.
Ha ke tata kwang ka di-1 tsa kgwedi yona eo. Ke rekile, cause ne se ke founetse hore ke tla kwano. Ke rekile medication ya ka for beke, e entse 405 rand, 50 cents.
My medication,
Dipidisi fela.
my medication for the entire week
Really,
cost me
boss?
105 rand,
Re
405 rand.
thuseng, ke kgathetse. Thank you.
Thank you.
Thank you, ma'am. Would like to hand over to the panel if they have any questions. No questions. Okay, that's fine. Would like to invite the next community. So Harrismith, if you don't mind just exiting this way and taking the seats at the back. Mama, you may remain seated. Sorry, no, excuse me, sorry, you may remain seated. The panel just have a few words for you. Okay.
Hello, Boa. Thank you very much. I think it's important for us as the panelists to acknowledge your testimonies and to acknowledge the situation in your community and in Harrismith.
Ho bohlokwa hore rona panele ho lemoha ditori tsa lona le ho lemoha maemo a le phelang ka hare ho ona ka hare ho Harrismith.
What your testimonies highlight for me about the state of the health service in the Free State
Seo ditori tsa lona di mpontshang tsona ka lebaka la maemo a dipetlele
is that health is primarily determined by the political, economic, and social situation that you face.
ke hore bophelo bo botle bo etelwa pele ke mathata a re na le ona a economy le social.
It speaks to the need for us to call on our health facilities to ensure that you do not pay out of pocket for health services.
By health for the health services.
That includes transport,
Transport,
having to use your cell phone, airtime,
ambulance,
medication, and needing to access expensive private services. Your testimony also speaks to the need for patients' rights and the rights of the families to be respected. It speaks to the constant need for information. And more importantly, the need to be provided the emotional support when someone is ill, be it yourself or a family member.
Thank you very much. Okay, we can ask the community of Harrismith to just move to the back. Even you can occupy this row behind you.
Harrismith,
Would like to invite forward the community of Monotsa.
Community
Okay, you can come to the front and sit in the front. Okay, Danny Boha. Okay. From Monotsa, we would like to invite Anna Mutau. Okay, ma'am.
I thank you.
Anna Mutau,
I, Anna Mutau, living in Mononta, having problems about our hospital, Elizabeth Hobbs Hospital. I do a clinic. I took her like on 2 occasions.
ba re ke mo ise Elizabeth Ross.
They told me to take her to Elizabeth Ross.
Ke la ka mo isa Elizabeth Ross,
I took the child to Elizabeth Ross.
e ne le Mantaha ke mo isa Elizabeth Ross.
It was on a Monday when I took her to Elizabeth Ross.
La bobedi,
On Tuesday,
ha ke fihla moo,
when I arrived there,
ba re ba tlo mo fa madi,
I was told that they were going to give her blood.
ba re ke saenele madi.
They told me to sign for the donation of blood,
Ke la ka saenela madi ao.
and then I did sign.
Ka Laboraro,
On Wednesday,
ha ke fihla,
when I arrived,
ka thola ngwana a le weak jwalo.
I found the child to be very weak.
A sa tshwaneng le ha ne ke mo tlisa moo.
She was not like as before when I took her to the hospital.
La bone,
On Thursday,
ha ke fihla,
when I arrived there,
ke bona ha a sa kgona ho bua le nna.
I could see that she could not even be,
Ke tseba a na tshwerwe ke hlooho le maoto fela.
because I only knew her to be suffering from a headache and she had leg problems as well.
Le di-test ne ba di entse clinic-ing,
And the test that they took at the clinic,
ne di soka ba di ntsha,
the results went back yet,
hore ke tsebe hore o tshwerwe ke eng.
so that I could know what was wrong with her.
La bone,
On Thursday,
ha ke ya hape,
when I went back again,
ke thola ngwana o ntsa ba weak fela.
I found her to be even more weaker.
Friday ha ke ya,
On Friday, when I went back,
ngwana hae.
the child was not there.
Ke botsa hore ngwana a ka o kae.
I asked around where my child was.
Di-nurse tsa Elizabeth Ross
This is over Elizabeth Hospital.
di tla o etsa eka o thola.
They will make you seem like a fool.
Ba re kena moo,
They'll tell you to go
o mo shebe.
and to look for her.
Kena moo, o mo
They
shebe.
told me to go to another room to look for her also.
Ebile ke ya ho sister moholo, motshwari wa moo.
I went to the supervisor
Ke mo botsa ngwana a ka o kae.
and then I asked her where my child was.
A re tsamaya line e kaofela o shebe.
She told me to go through all the halls and look around.
Ke thola hore ha ntse line eno ke ya bo ntate moo mo sekiateng.
And when I got to the halls, I could see it was only males there.
Ke kgutla,
And then I went back.
ke re ngwana a ka o kae ha ke mo thole.
I asked her where my child was. I could not find her.
No, ha ba njwetse straight.
They did not give me a clear answer.
Mme o mong a kulang,
Another sick mother,
a re ke utlwile
she told me that
ngwana wa hao o isiwe step down.
your child was taken to step down.
Ke re step down e se kae?
I asked her where step down was.
A re ke a tshaba hore ke o jwetse.
She told me she was afraid to tell me.
Ke tswa o botse ma-security hore step down e se kae.
She asked me to go out and ask the securities where the step down was.
Ka be ke
And then I went out.
fihla ke botsa le security
And then I asked one of the security guards,
hore ngwana ka motho o step down e se kae.
and I asked him, like I was told that my child was a step down, where was step down?
And step down seo sa teng
And that step down
se kopane le moshaka.
was combined with the mortuary,
And se hole,
and it's very far.
security lena la mpontsha.
And then the security guard showed me,
Ka be ke
and then I went,
ya ho step down le moo.
and then I went to step down.
Ke fihlela hore ba ithuka moo.
And then I found two people that stepped down.
Ha ke nahana mahlo a hae feela a ne nshebile.
When I think about her eyes, they were staring at me.
A sa kgone ho bua.
She could not even speak.
A sa kgone ho bua ka moo.
She could not even be able
A
to speak.
nshebile feela.
She was only just staring
Ke
at
re ke
me.
bua le ena,
I tried to talk to
a
her.
sa bua.
She couldn't speak.
Ke tla ho yena.
I went to her,
Ke mo tshwara ko ke re o tla bua.
and then I touched her, maybe thinking she could be able to speak.
Ha ke mo tshwara,
And when I touched her,
o tletse dipidisi feela ka moo.
or she was only filled with medication.
And
And now
habazi mo step down.
they went further to step down.
Abafui medical hape mo.
They weren't giving any medication.
Dipidisi tse o di tsenile. O di fesane di dipidisi tse ba go fapa.
The medication were the ones that she was given at the previous
O ba
hospital
le di green ka bo.
because they were getting inside her mouth.
Ila ka di tsaka ka bo.
And then I took them out of her mouth.
Ka di tsaka.
I took them
Ka
out,
go tla bua.
thinking maybe she could talk now,
A ka ba.
but she didn't.
And o be le green ela ya e ka bo la ya.
And there was a corpse grave there nearby the door.
Ka be ke tsa ba ya sepetlele.
And then I went back to the hospital.
Ke fihla ke ya ho sister.
I went to the nurse
Ke re ke kopa o etse ngwana ka discharge.
and then I asked her to discharge my daughter.
Ula hana.
And then she refused.
Ka re o etsa ngwana ka discharge.
I asked her to discharge my
A
child.
re kele ke di etse discharge.
And then she said she
A re
wouldn't.
tlo go kala ho hobane ha hona ntho e tholang, ha thole dipidisi, ha thole meriana, ha thole le dijo moo.
Because she wasn't receiving any help, any assistance, no medication.
A re hona
And she
wena
told-
ha ebe o doctor mo,
She told me, if you think you're a
o
doctor,
tla mo nka.
and then you will take your
Ka
child.
re o tla bona ke tlo be doctor today.
And then I told her, I am going to be a doctor today. I am going to go fetch my daughter.
Ka be ke tsamaya,
And then I went back
ke lo batla koloi.
to look for a car.
Ka kgutla hape,
And then I came
ka re
back.
ke lo lata ngwana ola, ke batlile koloi e eme ka ntle ka.
I told her that I am going to go fetch my child. I have found a car.
A re etsa ka o mong ka o lo shwa ha fihla hae.
She told me to go fetch her daughter and that she was going to die upon her arrival at home.
Ka re le sepetlele mo tsa tlo shwa.
And I told her she's still going to die even here at the hospital because she wasn't receiving any assistance whatsoever. And then I took my child. I was with her for about a week at home, but she was very weak now. On a Sunday, the following week, and then she passed on.
And it really happened. It came happen here, clinic ya Molomisi.
I'm also claiming about the Mononsa clinic.
Re na le mathata, ke na le high blood,
We have problems.
ke na le masapo,
I have high
ke na le
blood
di-ulcer.
and ulcers also.
Mara ke thola fela dipidisi tsa high blood fela.
But I only receive medication for high blood only.
Ntho tse dingwe ba re ha di.
For other things, I'm told that
Ka
they
re-
aren't available.
ka re ke a tseba hore ke jwang,
And then I told me the new
masapo
medication,
a ngaka a jwang.
my bones are very weary.
Ba re a tsamaya ho reka.
They told me to go buy myself my medication.
Se ke na le 2 months ke ithekela ntho tse ding.
I've been buying myself my own medication for about 2 months now.
And mo re bewang teng,
Then where we are kept,
re bewa ka stoep.
well, we only kept it in a stoop.
And nahana Maria ke ho dula ha rona ka stoep ho tloha ka 7 re dutse moo.
We are kept there from 7 and it's very cold since it's winter.
Hore ho jwang.
I thank you.
Thank you, Mama.
Hello, with your mama.
I will just hand over to the panel if there are any questions.
Jwale ke tla fa tshwanela e le hona le dipotso.
Nothing. Okay, that's fine.
Ha hona letho.
Okay. We're going to invite Ms. Sizakele Sibeko
Re tlo mema-
to give a testimony.
re tlo mema mme Sizakele Sibeko ho tla fana ka testimony ya hae.
Ke le Sizakele Sibeko,
Sizakele Sibeko,
ke tlolla ka bakudi ba di-MDR for TB.
I'm here to complain about TB patients.
Batho ba di-MDR ke nahana ba bangata ra tseba hore ke batho bane ba tshwerweng ke TB e kotsi.
NDR people are the ones who are suffering from a very severe TB.
Lefapheng monana, le itse ke na le problem ya hore batho ba di-MDR ha ntse ba ya sepetlele for ho lo bona doctor. Ba ntse ba tsamaiswa ka dikoloi tsa bakudi.
In our department, all the TB patients When they were suffering, they were took to the hospital by an ambulance.
But no,
But now,
it's a little way to transport a bone.
it's been months since they've been transporting themselves, their own money.
Public transport to hospital,
They use public transport to the hospital,
could mabalo is traveling.
or even with their severe condition.
And I happy. Bawang could.
And other patients,
But I'm looking at mask because back I know like in the mask, how I public buy about two.
they too ashamed to put on masks.
So no general tolam that about Bawang, Abakono Yamo for review for doctor because of challenge.
Now we are encountering other problems that others aren't even able to go to the doctor because of financial.
For daily treatment, they are one.
For their daily treatment,
Other clinicing every day
they come to the clinic every day
because how this class.
because if there aren't any CWs
Then you want to basic the treatment high.
who could go give them their treatment at home,
Emong end up actually bake as a honor fit that clinic to have medication high.
one of them went the entire week without even receiving their medication.
Emong more at the day usual can I a public transport.
Some of them, in order to be able to go to the hospital, they have to use public
And
transport.
the rural area,
And we live in a rural area.
the clinic is old.
Clinics are very far.
We have to take a motor to go to the clinic
Kamena renge koloi ya
and
clinic
you will spend 150
and ukapena 150
to go there.
kuya mundu.
So we have a problem.
Nye na la kutata.
Our community are dying.
Community yaona iyasho.
It's a developed MDR thingata.
We developing too many MDRs
Can we also the community health focus because patients that could fit the clinic over the medication wabo.
because of lack of CHWs, because patients aren't like they can't be taken to the hospital.
Elenya duduso I think the malakwan.
The one that was set up by Mr. Malakwane,
Are only battle how could I beg
and when he came back,
Casa Sarenki Confela?
and they didn't take all of us.
The study who volunteered 2001, that one the June.
I started volunteering in
I
2001.
developed a national 14 years.
When he fired me, like I had 14 years of
The
service.
whole Hamid started and the whole 500 21.
When I first started, like I got 500 rand for as my salary, and then we were sharing it with about 21 other people. And then it went on to a point where each person got 500. That time it was Ms. Oma Toko. Then came in Mr. Ballot, and then they increased the money to 1,000 rand. And then it has been like that since. After many years,
Increment.
when they gave us our increment,
100 rand.
or they would only increase by 100 rand.
How did this a high in the Malawan?
When he returned to us, Mr.
How
Malakwan,
did this has a total 1.4?
he returned to us and he only gave us 1.4.
And what's about the qualifications?
And now he's demanding qualifications,
What's the average Baba Hole?
or he's telling us that some are very old.
Not to like clean for 24.
When I got to the department, I was only 24.
Only 35.
Or he returns me when I was only 35.
As I'm part because second more like metric. Like okay.
He doesn't want me anymore because I don't have a metric and my age is against me.
Narukupa too so
We're seeking for help
because no color be like actually
because we were able to live with that money.
because how we
We were able to help our communities.
never gonna look at about trouble community. The file is about treatment we are high.
We
But
were,
for no clinic.
we were able to give chronic patients their files who could not go to the clinic themselves.
How much about one by suffer?
Now those people are suffering.
Baba Mabangata Bafoka hit.
Some of them have passed on.
Ka baka la hore treatment ha ba kgone ho e thola.
because they couldn't get their treatment.
So ne re kopa thuso.
So we're seeking for help
Hobane ha re tsebe lebaka.
because he didn't even give us any reason.
Ha re tebela go tebetsa re sign-tse diformo tsa di-PESAL, ha re go fa di-PESAL.
When he returned us, he only made us sign forms,
Ka
giving
mora
us
diformo
false
tseo,
certificate.
ha a hlahisa la wa go stopa. Ho na le batho ba jang tjhelete ya rona e re patalang. O batla go control-a ntho eo. Khathe ke a re tebela.
After those forms, and then he stopped us, telling us there were people who were eating our money while he's on a mission to stop that. Meanwhile, he was busy on a mission to find them.
Ne re kopa le kene re thuse.
We're seeking for help.
Ha re kopa ho yena nou tjenana hore re kopa re etsetse mangolo hobane ba bang ne re na le dintho tse ne re di rekile dishopong.
When we ask of him to give us
Re
some
kopa ho
letters,
etsetse mangolo hore ha re sa sebetsa.
we ask him to write us some
O wena
letters.
ha re tebela. Ka mmotsa re jwanong re etseng hobane dishopong ha bana problem ya hore patelle di-employment tsa rona tse ne re di nkile. Ba batla fela proof ya hore ha re sa sebetsa, o re ha re tebela.
He's telling us
Ba
that,
se selemo jwale re le hae.
But it's
Mara o
been
re
about
ha re tebela.
but it's been,
Ha re jwetse hore na o tlo etsang ka rona.
it's been for
Ha
about a
o
year.
bua ka rona.
It's been for about a year now since he's done nothing, since he's dismissed us. And when we ask him, well, he's kept on saying that he did not dismiss us. I thank you. So we have all.
We're now going to invite Tate Saote Masiu.
Ana jwale re tlo mena Ntate Saote Masiu.
Thank you.
Wa leboha. I thank you. I'd like to greet all in here.
Ke tsa tleliniking ya Magalane Parola district ya Monontsha.
I'm from Magalane.
Ke batla ho bua ka kopo ya hore re haelwe tleliniki.
I would like to talk about a request for us to be built a clinic.
Ka April 2005 re ngoletse Ntate Sekio Bello re kopa ho haelwa tleliniki.
In 2005, we wrote Mr. Sekio a letter for trying to build us a clinic.
A ba re kgetha hore re bue le district le region ya
And then he told us
Eastern
to
Free State.
speak with the Eastern Free State Division.
Re buile le yona ya re tshepisa ha e ka ba hlola e kgutlela ho rona.
We did speak with them, but they never got back to us.
Ka 2010 re buile le mme Sisi Mabi
In 2010, we spoke to Ms. Sisi Mabe,
le yena a ya e bona.
and she also saw it.
Ha qeta ho bona hore ha e sa le tleliniki ke ntho e ka welang batho.
After seeing it, that it was no longer a clinic,
Re ne re bua re le ho NCOP mane kwa Komane.
we were at this NCOP.
Ho la hore ha se tleliniki e tlo fihla batho.
She even presented it to the president that it was not a clinic anymore,
Hona moo NCOP
right there at the NCOP.
a re o tla kgutla
And then she told us she'll come back
ha
to
so
us.
kgutlile yena.
Still today, she hasn't.
Re ngolletse letona lena le letjha
We wrote to the new head of department.
le yena o ntse a le jwalo o tshwana le one ke re phela lefatsheng la ditshepiso.
Well, he's only just like them. He only gave us promises and
Bohloko ba tleliniki ya rona mamati a teng a se bile ka tuo ka hodimo because ha bulele.
some of our clinic doors aren't even
E a bonahala hore e ntse e ya fatshe.
but stumbling down.
Ha o kena ka dispensary meriana le mabapi ke ra tent.
When you get into the dispensary, all the medication, some type of pain containers.
Ka mantswe a mang ha re sana tleliniki.
In other words,
E kana ya wela batho.
we are at the danger where it could come tumbling down on people.
Ka 2013
In 2013,
ba ile ba hlahisa kontraka e tlo ha tleliniki mo Magalane.
they proposed a new contract that was going to build a new clinic in Magalane.
Ba re fa le dipampiri ra bona le moaho wa tleliniki.
They even gave us the paper. We even saw the plan of the
For
clinic.
4 months ne re cleana sebaka seo tlo ha wa ho yona.
For 4 months, we were cleaning the area where the clinic was going to be built.
Hona mo fela ka hara tlama tse ntse re di cleana mo kontraka e le yona.
And then it ended right there and then.
So petelong ha ka ba tseba ho etsaetse jwang.
in the end, we did not know what happened.
Ile ka fumana vaccine e tse district manager ya rona mane.
That was me for the district manager, our district manager.
Ore ha re no kgona ho thola clinic pele lefapha le ka se tsaha ile pula clinic ta ba bona e rarollwa.
Telling us that we will not be able to receive the clinic until the department has resolved this problem.
Motho ya ile pula clinic o kentse complain public protector ore o kwallwa tsela le ena ha dumele ho kwallwa tsela ya hae.
Somebody who's just next to the clinic has also laid the complaint or that they closing like his road, so he was not able now to use his road now.
Jwale lefapha le re di eme le se le motho yo e kgona hawaneng.
Now the department doesn't know what to do.
Ntho e kotsi hape clinic ya rona
What's more dangerous about our clinic is
ho haella ha meriana.
piling up of medicine.
Batho ba rona ba ya hoseng ka bo 4:30.
Our people go to the clinic in the early hours around 3:30,
But I didn't say Chinese.
and then they'll come back around 4 when the nurses knock off.
Hangata re thola re na le nurse tse pedi kapa tse tharo clinic for the whole day.
And many times we only have like 2 or 3 nurses in the clinic for
So
the whole
ke mathata
day.
ya clinic ya Makgalaneng.
So those are the kind of problems that we find ourselves facing.
2012
In 2012,
premier ola announce clinic ya Makgalaneng e fedile hana bua ka puo ya province.
our premier announced the Makgalaneng clinic to be finished,
Jwale ha re kgone ho e thola na o e haileng taefe Makgalaneng tse re ba.
but now we don't know where the clinic was built. We still haven't found the area.
Re tse re sheba le di mona di mo dithuto bolong ha eyo mo o ipatlile.
We're still looking for clinic even now. We still can't find it.
Jwale re sheba ka di internet le teng ha re bone.
We even went onto the internet to
Ka mantswe a mang re phela lefatsheng le tshekisang.
have a sense of false security.
Re a tseya re ko re bohloko re a tseya. Re lefatsheng le tshekisang fela.
We're in pain and we laugh about it at the same time.
Batho ba ya shwa ka clinic ba tswa ba nko ka dikolo tsa dimoshara.
People are dying in the clinic,
Empa hona le batho ba sa utlweng bohloko kapa ba sa bone ntho.
but there are people who aren't feeling any pain or who are not even able to realize that.
Ka hara motse ono ke sebetsa ke le community service ward committee.
In our community, I work as a community service in the work committee.
Jwale e dula e ntlisa mono ba le nna ke re ke a tla ke sebetsa le bona moo. Hore e tla loka neng taba eo. Re swabile mme ke a leboha ha ka la re thusa hle batswadi ba rona.
We are very ashamed.
Ra iphumana re na le clinic le rona re thaba.
Now, if you could please help us so that we'll also have a clinic,
Maboteng mona o kenya lenana tjena e tswella ka nqa.
because you can put your fingers through the walls.
Ha o ka ba le motho yo mong mohlomong a ka tja mopaki a lo nka dinepe a e shebe hore ha re buile shaka.
If there was anyone who could be sent maybe to take pictures.
Ebile ha ke no
evidence.
swaba o ema kae kapa kae ho bua ka clinic ya Makgalaneng.
And I won't even be ashamed to spend any word to talk about the clinic,
Hoba batho ba shwa mo ke ba bone.
because people who die, they are our own people.
Nna ebile ke pata mehlae.
And I pay all the time.
Ha ke sa thabela ho pata batho ba shwela clinic bana kana ba thusa.
Not really happy about bearing the people who die at the clinic anymore.
Ke a leboha.
Thank you.
Thank you, Tate.
Thank you, Tate Alabo.
Okay, we can hand over to the panel now.
Hona jwale re tlo nehela ho panel.
First of all, we as a panel want to bring our condolences to those of you who've lost loved ones. First to Veli from Harry Smith.
Re qala ona re le panel. Re rata ho re lebise kutlwelo bohloko ho bao bohle ba eleng hore ba lahlehetswe ke batho ba bona. Re qala ka Ntate Veli a hlahang Harry Smith.
And then to Anna.
Ho mme Anna.
We can talk here in this commission,
Re ka bua mona commissioning,
but you will carry on for many years.
ba le tla tswella dilemong tse ding tse tlang tse ngata. Ba le lahlehetswe.
And we want you to know that we recognize that pain.
Empa re ka o le tsebe hore re a lemoha bohloko bo.
May God heal you
Modimo a le fodisa
as He walks with you.
jwalo ka ha ntse a tsamaya le lona. Ke a leboha.
Again, the testimonies that you've given, again, speaks to another cycle that we're going to see. And I'm sure the next
Testimony tse leng hore le qeta ho fana ka tsona di re lemosa mathata a leng hore le iphumana le tobane le ona.
there is a sense of collapse and frustration that I'm hearing.
Ke utlwa dillo le ho ferekana
About the state of facilities that you are having to access or cannot access because you cannot
a dibaka tsa dipetlele kapa tsona ditleliniki tse leng hobane le tseo leng hore ha le kgone hore le fumane.
when you seek recourse or understanding
Ha o batla-
information,
ha o batla thuso kapa yona kutlwisiso ya tseo,
there are layers of non-responsiveness,
ho na le mabaka a ho sa utlwisisi
be it at the level of the facility
mona leveleng ya facility
or at the level of the province, those tasked with the decisions to provide you with the necessary services.
kapa leveleng ya kwana moo e leng hore bao ba fuwe lona lebaka kapa mosebetsi wa hore ba iphumane le hore ba le thusa empa ebe ha ba le sebeletsa.
The other thing that I've been hearing
E nngwe ya dintho tse ntse ke di utlwa
is that in a province with almost 40% unemployment,
porofenseng e leng hore e na le 40% ya batho ba sa sebetseng,
those who want to work,
ba e leng hore ba batla ho sebetsa,
those who want to provide care
ba e leng hore ba batla ho fana ka hlokomelo,
are not being recognized
ha ba lemohe
and not being paid
ebile ha ba patalwa
or being trained.
kapa mohlomong ona ho train.
The burden that these communities are facing from just the two sessions this morning
Boima bo e leng hore di-community tsena di tobane le bona ho tswa fela sessioneng tse pedi tsa hoseng hona,
is a burden that is expensive,
ke boima bo e leng hore bo ya tura,
costs lives,
bo fetisa maphelo,
and importantly, places a burden on women in these communities.
ebile ha bohlokwa bo fana ka boima bo bong ho batho ba bomme di-community.
And we need to see both an acknowledgement and an understanding of this burden and of this cost.
Mme re hloka ho bona bobedi kamohelo le ho ya hore batho bana ba hloka hore ba thuswe.
Thank you very much, the panel.
Ke leboha haholo for panel.
We want to also thank the community of Monash and would like to invite you to take your seats where you are seated at the back. Thank you very much for your testimonies.
Re rata ho leboha community mme re tla le kopa hape hore le kgutlele morao moo e ne ntse le dutse teng pele.
Our next community is Seki Kwakwa.
Community ya rona e latelang ke Tseki Kwakwa.
Would you like to come and could you come and occupy the front row, please?
Ne re kopa ho le memela hore le hle le tlo dula ka pele.
All the community members from Seki Kwakwa.
Batho ba community kaofela ho tswa Tseki Kwakwa.
Thank you very much.
Ke lebohile haholo.
Would like to invite Miss Emily Masedikane.
Re ka rata ho bitsetsa mme Emily Masedikane ka pele.
Thank you, ma'am.
Ha ke le dumedise batho ba ka mona kaofela.
E re ke qale ka ho dumedisa, let me first greet the people in here.
Nna ke Emily Masikane ke tswa Qwaqwa.
I'm Emily Masedikane from Qwaqwa.
Ke tlile mona ka TAC ho ka hlalosa ditletlebo tsa ka.
I came here via TAC to just lay my complaint
Hobane ke motho e mong a ntse ke le patient e kgolo ho tloha 92.
because I've been a patient since 1992.
But ka di 7 tsa April ke ile ka khuma mokokotlo ka kosa ho ya tleliniking.
But on the 7th of April, there was a problem with my spine that caused me to go to the clinic
E le hore bothata ba ka ntse ke na le bothata ba masapo and like yeah.
because I still had a problem with my bones.
So itse ha ke fihla tleliniking ka di 7 hoseng, ngwaneso o la founela ambulance before ba nkisa tleliniking.
My brother called an ambulance to take me to the clinic,
Yaba ambulance ha etle,
but the ambulance never pushed up.
yaba o founela mama wa hae o ra nkisa tleliniking.
And she called her husband to transport me to the clinic,
Tleliniking ya Thabiseng.
to the Italicen clinic.
Itse ha ke fihla tleliniking moo,
And when I got to the clinic,
ke fihlile hoseng ka ba 7:07.
I got there early in the morning around 7 o'clock.
Itse ha ke fihla ka fihla ba nkopela ba nkela wheelchair.
They took a wheelchair for me.
Wheelchair ya teng e sena le mabidi a hantle.
The wheelchair didn't even have proper wheels.
Ke ha ke kena ka hare ka wheelchair.
And then I went inside with the wheelchair.
Ne ke painela haholo ke mohlatsetsile.
I was in terrible pain.
Ya be le hore ha ke fihla lane ke qeta ho pompuwa, ke qeta ho nkuwa motjheso.
And then when they just checked my high blood and I was pumped,
Ke kosa ho ya ka dineseng ho ba lo ncheck-a.
when I just approached the nurses to check me,
Ke ha dinese di tswa kaofela ba re ba ya meeting
all the nurses went outside saying they're going to a meeting
Riverside.
at Riverside.
Ka se ke painela ke fihla wheelchair mo ho sena nese ka hare ho clinic ya Thabiseng.
I was still sitting there in much pain, no nurse attended to me.
Ba kgutlile ka kgola ka bo past 11 to 12.
They came right about past 11, around 12 as well.
Itse ha ba kgutla moo ba fihla ba nkenya ka hare.
And when they got there, they took me inside
Le teng ngwananyana ena a ntswa salon.
with that lady now quarreling
Hobane yena o ba tseba kaofela manese a Thabiseng.
because she knew all the nurses there.
A re na hobane ha le siyo ka mona ka bolela ba mo thusa before.
She was complaining about why they left her there, not helping her.
Itse ha ba qeta ho nthusa moo,
And
ba
I,
nkile dipidisi tse pink tsa di-Peppercorn, Peppergens.
they gave me pain pills called Petagens.
Le teng ba kwatile ba sa ba ngwananyana wa nka ba komela moo.
But that only happened after the lady she was with complained to the nurses,
Ha ba qeta moo ba re ke yo robala hae.
and they told me to go sleep.
Yaba ngwananyana ena se wa ba re jwetsa hore ausi wa ka ha se motho wa ho robala hae a penile hakanakana. Ya le sa mo ise sepetlele.
The lady she was with told the nurses that she can't go home and sleep in her condition. Why don't the nurses take her to the hospital?
Ke ha nese ena e re ha se nese, ke yo robala hae.
And
Ke
the
tla
nurse,
tlosa.
and the nurse told the lady she was with that she's no nurse, she has no experience.
Ah,
Her mother has
well,
to go
how-
home and sleep.
A re na jwale ha ka kula bosibu teng ke tla mo etsa jwang?
And she asked, what if she gets sick around night?
Ke ha o ba masala moo ba re a tla bitsa ambulance.
And they gave her a letter that she should call an ambulance.
Ka la ke ikare le hore bosibu boo ke kgona ho roba.
Well, luckily enough, she got some sleep at night.
Then moradi ya ke yang prek ulang ka ke dipilisi tena tsa masapo 50 petal ke Panadol.
because her daughter had bought her the pills for her bones.
Kana ke ana ka baba.
She drank them and she slept.
E pa se ni ta di fitela ha pe ta ro wa ba fene o ba juta ha.
And in the morning, the pains came back and she called them and told them.
Bana ba ke ngolo le ya ka ba bula make.
They said that she should never open the letter.
Ke ha mama ha le ko me ra an ki se na Elizabeth Rose.
And her husband called her to tell her that she should transport the Elizabeth Trust Hospital.
E ka fitla Elizabeth Rose ba ko te tleliniki na ba ngolo le den ha ba tlo mo.
And when she got to the hospital, they told her that they can't recognize what's written in the letter. She has to go back again to the clinic to get another letter. When she got to the clinic, they wrote another letter, which she had to go back to the hospital. When she got to the hospital, they told her that x-rays don't work. After that, they had to transfer her to Manap Hospital. The ambulance took her to Manap. At the initial hospital, she was there from 7 o'clock in the morning up until 1 o'clock. She was in pain and in cold as well. She was transferred to Manap Hospital, and at Manap Hospital, they told her that she has to go back again to the Elizabeth Trust Hospital because the doctors can't recognize letters that are written by the clinic nurses. Even the doctors weren't even there, they were in a meeting. And then the lady she was with inquired as to what if she dies, who will be responsible for her passing on or for her death? And the nurse told her that she must go back to Elizabeth Trust Hospital because she doesn't understand what she's saying. She slept on a stretcher and went back to the hospital. And when she got to Elizabeth Trust Hospital, they told her to go home. That Monday, she must go back to the clinic, they fixed the letter, and she should go back to the hospital. She stayed up from Tuesday up until Monday. That's when she went to the clinic. When she got to the clinic on Monday, they did the same thing, wrote her letter and said, go back to Elizabeth Trust Hospital. Same thing happened when she got to the Elizabeth Trust Hospital. Her x-rays don't work, so you need to go to Manap Hospital. And when she went to Manap, they eventually put her into the x-ray. And when she got back, they took her back to the hospital in Elizabeth Trust. There was only one doctor examining us. He checked us, the x-ray patients at around 2, and there were so many patients, but it was only one doctor. And after he had examined me through the x-ray, he took me home. And they told the lady I was with to go take my medication. And when she got to the pharmacy, in the hospital, they told her that it had stock out on pills.
Ba re reke dipilisi tleliniking gore ke kgone go ke reke di-Panado ke kgone go diteng tse di bone betere.
And they told her to buy Panados just so that she gets better.
Ka nako ya go sebetsa ga kgone le teng.
That time she doesn't even have any income, she's unemployed and she doesn't even get pension.
Ke tsamaya ke hae.
And then she went home.
Go fitlhela ga jalo ga ke so gape tleliniking mara ka ba rekela dipilisi chemist-ing.
The child bought the pills for her, even up until now, she has never even went to the clinic.
Re ke na le dipilisi tsa chemist teng mo.
She's
Thank you. Thank you, Mayor. Would like to invite Lydia Mofokeng.
Lydia Mofokeng.
Ke a dumedisa ka lebitso la Tlala Morena Jesu, ke dumedisa bohle ka ho qolla, ke dumedisa panel ya rona le bohle naga re fapane le setjhaba sa rona. Mo ke Lydia Mofokeng ya tswang Qwaqwa, Tseki.
I would just like to start with greeting all the people in here in the name of the Lord Jesus Christ, specifically greeting our panelists and the house at large. My name is Lydia Tseki from Qwaqwa in Tseki.
Ke sebetsa haholo le setjhaba, ke ka hoo ke ratang setjhaba.
I work greatly with the nation, that's why I love the nation.
Hobane ke kgethwe ke sona ke le audit committee member.
Because I was chosen by the nation as a work committee member.
E sale ke audit committee member, ho tloha ka term ya bobedi, makhanselara a qala ho dula.
I've been a work committee member, this is her second term, and she's been chosen by the people. We have great problems. Moreover, us, because now the community is looking upon us for assistance and help. And where I live, my neighbor lives with her grandchild. She's an old woman who lives with her grandchild. Whenever here's an objection, his name is from the Tariel.
Do you mind? We just need to finish first and then we can. No.
It's not one of the biggest organizations in Africa or in South Africa. It's supposed. Department of Health is here. They're the ones who are supposed to answer those questions. Yeah. So currently, you as the TAC, you are not the public protector, you are not the Human Rights Commission. So I'm saying to you, listen.
Excuse me, hello? Okay, no. Okay, we have given, hold on. No, we have given, no, hold on. There is an hour allocated to the Department of Health to respond. So it's, no. The Department of Health will be allowed to respond. No.
Listen to, listen. Comrades, 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 hold. Listen, Chief, if you have anything to say here, there is a chairperson, you can write your name, and then you can give your testimony. You have no right to come here to tell us what to do and what to say. I said listen. I want to listen. Otherwise we'll manhandle you if you're gonna pick up a problem. Yes, we will. What? Sit down. We're not going to give you any chance. We're not going to give you any chance. Listen. Wow, this is not my favorite. Yes, yes. Actually, party bamboo territory. Talapans, Examine the talapans. Talapans. This is not a LGBT. This is a community meeting. Let's go. Just wait. Just wait. Just wait. Just wait. I want to put your fire and then you bring it to the high officials. Very here about the job. Where I just said there.
I agree with you. We have a process. If anyone here want to talk, there's a chairperson, you come, you write your name there, your name will be called, you come in front here, then you give your testimony. Whatever that you want. This is South Africa, this is not Banana Republic. So you cannot just say the talk because this is nothing to do with me. Forget it.
And then if anyone question us not responsible, we have to go outside.
Comrades, anyway, it was time for break. May we take how many minutes, Jefferson? We're going for 15-minute break, please. 15 minutes.
Do everything, then we can come back into the very same venue. Don't worry. Everything is under control. Really, I feel like doing the nothing job.
phansi ibambe umthetho. Ayihlale phansi ibambe umthetho. Hlala phansi. 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 Comrade, let me apologize. Let me apologize first to our panelists. Let me apologize to all the elders. Let me also apologize to everyone that is here. We can continue in peace with our session. So don't feel intimidated. This is your space to speak as a community. Am I right? The right? Okay. Chairperson, thank you.
Thank you. Okay. Lydia will continue.
Ke a leboha hape sebaka seo ke se fumaneng. Ke tla kena tabeng se tla kgutlela morao hoba se ke hlalositse hona hobane setjhaba se tosa bosibu se batla ke founile di-ambulance. Ho na le problem e etsahala ka di-29 tsa March.
On the 29th of March this year.
Mohaisane wa ka
my neighbor is a very old woman who lives with the grandchildren. The grandchildren are orphans. He wasn't very sick, and on one occasion he went to play soccer. When he was about to have his meal, he felt that he needed to vomit. And the grandmother called her as usually she does. And the grandson was lying on bed, but he fell. So when she got there, she got the boy he had fallen down from bed. And then they lifted him up and put him on bed. He couldn't speak, but all he was trying to communicate is there's something wrong with his chest and he needs to vomit it out. Well, it looked like if he could be attended to, he would have been well. And then she called an ambulance. And then the Bloemfontein people said they called Chocha people. And then she kept calling several times. They told her to wait. And then the situation was worsening up. And then she went to another neighbor. She went to the neighbors to try and tell the neighbors to be with the grandmother. Then she goes and calls a social worker. That with her expert help, maybe she might assist. But they were kept on hold from 4 to 5 hours, just on hold. Until she went out at night, went down to seek for a person in the car. And that gentleman was not there, but fortunately enough, his daughter can drive. She wanted to discuss prices first, but then she told the lady that we can discuss prices after.
Ha e fihla a re wa tlosa tsa apara.
And then she was dressing up.
Ke matha ke ya ho shosholola ke hape ke ho lata hore re tla mo go dira teng.
She went back to the social worker to get her and then they. The ambulance kept on saying, just hold, just hold. Eventually she got a car and the social worker to that place. The car, when they arrived at the place, the car was there, but she thought the car had took the sick person, but it went to the police station. When they took the person who was sick into the car, but and then they discussed it that nobody should know. Okay, what happened is the lady with the car realized that the child had passed on, but she didn't want to break it to the grandmother. So what she did is she took back the child and told the grandmother that if I have to take this person who's in this condition, I first have to call the police. So she took the child back. Because they were not aware that the child had passed on, they were trying to just wake him up. And eventually the car came with the police. And they wanted to know who was calling an ambulance. Both her and the social worker gave them. And they told the police to call just as they did. And the police were told to get back to you for 10 minutes.
5 hours is a
That happened after the 5 hours that they weren't aware that the child was had passed on. And the police, because they got no response, they left. They came with the first aid people. So the police fetched the first aid people. When they got there, they asked how long had they been waiting for an ambulance. And she explained to them. But it was of no use because the child had already passed on. Yes, it was now it came to attention that the ambulance crisis is it's happening very often. The child was buried. And then a month or two later, another neighbor got sick. It was just Sunday, just after church service, around 2:30. And then when she got home from church, her children told her that she's been sending people there for you. And when she went to her place, she got there and she found the neighbor vomiting. She was very weak, she couldn't stand up or do anything. She called an ambulance again. And they stood for a very long time, just being put on hold. She got another person to call with a different phone from the one she had. They stood for like 6 hours. Until she called another church member who was a neighbor.
ke kopa ka ditšhelete ka mosespetlele.
She explained the previous situation to this church member that we are afraid what happened last night might happen again. So please come and take this person to the hospital.
Ntate o batla fihla moo ka.
The church member came and took the mother to the hospital.
O ne tsamaya le nna le monna hae.
She was with her and the wife.
Ha re fihla sepetlele Manapo.
And when they got to the hospital,
Ha ba mo check-a ba re motho o mmeleng ka hona le 2 months.
she was checked and they told her she's pregnant.
Ntho e ka re ntho e se le mo ka ho yena. O ne ba le ile a bona ntate ke la a etsang. Ho founa di-ambulance di I don't know what I'm trying to
what happened with the sick lady is while she was still feeling dizzy and vomiting, that previous experience came to her mind. And then after the church member had taken her to the hospital, she was finally assisted. Some of the pregnant women were in the community that I live in. They give birth inside people's car. Because sometimes ambulances are called and it doesn't pitch up. Thank you.
Thank you, ma'am.
Lerato Botika, a tswang Fijini, o batla ka ntle. Lerato Botika, o batla ka ntle. Thank you.
Thank you, Benedict.
Thank you, Benedict.
We're going to, our next person to give, to testify is Tate So Paseda.
Mutanda Zamana Kapatula, do that so Paseda. Do that so Paseda.
Okay. Tate Simon.
That is no.
Okay, that's fine. Okay, so we want to hand over to the panelists to, if there are any questions or comments for this community of second.
Thank you, Chairperson. Let me begin by back. After we experienced what we experienced before tea. And I want to say we are all South Africans. And there's freedom of speech in this country. And there's freedom of association. What we are gathering from this area is that ambulance services are really a serious problem. But also what we have gathered is that the referral system is also not working well. You can't have the patient moving from a clinic to hospital, from that hospital to another hospital and back to that clinic if the referral system is working well. Thank you very much for sharing this experience with us. Because together we can work on these problems. Because we're all yearning to live a productive life.
Thank you very much.
Thank you.
Thank you so much to the community of Kakwa. We'd like you to take this, we'd like to go back to your seats where we see the second row. If the community of Welcome can get ready to come to the front.
Thabo Mbeko, Mtukisima.
Thank you very much. From Welcome, would like to invite Ms. Betty Mabuza.
Thabo Mbeko, from Mabuza.
Thank you. You can sit or stand, whichever one you feel comfortable with. Okay. If you have to stand, you can stand. If you have to sit, you can sit.
Betty Mabuza from Welcome, Thabo. I have a problem with Tebong Clinic. I was pregnant last year. I had done my whole 9 months. And when I went to the clinic, she last went to the clinic on February this year. On the 6th of February, the clinic. She was given a date with which she should come to the clinic. She normally went to the clinic on a Wednesday. And then she was given an appointment to come on Wednesday. Then she might be sent off to Bongani Hospital. When she got to the clinic, the sister told her that she can't send her to the clinic. She can only give her medication because if she transferred her to the hospital, okay, the sister at the clinic told her that she can't send her to the hospital because if she sends her to the hospital, the doctor is going to require her to come back because her stomach was inconsistent. It was sometimes big, sometimes small. And then the lady gave her the pills and then she went back home. On the 6th of February, she realized that there are signs that she couldn't understand. She went to Khotsong Clinic. She was walking. And when she got to the Khotsong Clinic, she saw some few ladies who were there as well. She gave them her file. And then the ladies were given their files back and she only got her file later on. She was called. They asked, what are you here for? She told them, I have a problem. They asked what problem do you have because your file has no dates which refer you to this clinic specifically. They told her go to the hospital. From Khoto to where she lives, it's very far. She went from the clinic walking, and while she was still walking, while she was still on the way, she made a call back. She made a call back to another, informing her that she's working from Khoto Clinic. She asked where she is. Her mother asked where she is. She told her mother that I think I'm about to give birth and I'm still on the streets working. She begged to God and prayed, and eventually she got home. And when she got home, she took her stuff and went to the hospital. When she got to the hospital, she gave the nurses her file and she explained her problem to them. They told her to sit somewhere in the hospital and she sat there for hours. After a while, she called her sibling and informed the sibling that she's been there and she's not getting any assistance. She was only attended to at 3 o'clock. And then she was taken in to sit in bed. She was told to sleep upright, facing upright. She was checked by more than 10 nurses, telling her that they're feeling nothing, they see no problem with her. Please wait for the doctor. She waited for the doctor. The doctor eventually arrived. And when the doctor arrived, he told her that just rest and sleep there on the bed. After the doctor had checked her, he looked her in the eyes. And the doctor asked, what does it mean if the child's heart isn't beating? She kept quiet. And then the doctor angrily said to her, what's going on if the heart of the child is not beating? She never replied. The doctor told her, I'm going to leave you here. The doctor told her that she be given a room and she went to that room. When she was in that room, before she went to the ward, the doctor said to her, this child that you carry, died in January. When the doctor just told her that, she was given a room. She was alone in the room. And then she sat on a chair while she was still sitting. She felt a terrible pain in her waist. And then she kept walking in that room until she rang a bell. And then a sister finally came. The sister asked him, are you able to give birth on your own? Can you do that? She replied and said, I can't give birth on my own, but the baby is finally here. And then she told her that she must go lie in bed, that she must check her. And then when the sister checked her, she saw that the head of the child was already out. That's then they only attended to her to help her give birth. I'm sorry. She eventually gave birth. She pushed to a point where she felt she's about to die. And then after birth, she was shown the baby. Couldn't see the baby. The baby was terrible. The baby looked rotten. But she accepted. After they helped her give birth, she was left in the corridors of the hospital. She was left there. Not even bathed. She was still in blood. The nurses who were coming in for the afternoon shift were the ones that attended to her. Thank you.
Thank you so much, ma'am. Thank you. Is Miss Julia Morema here?
Miss Julia Morema.
Thank you very much to the community. You're welcome. I'm just going to pass you to the panelists.
Betty, we have felt your pain even here in this class. You knew your child. And that child will journey in your memory. May God walk with you in the loneliness that you feel, in the sadness that you grief.
Thank you very much. We'd like to ask you to exit through this way and take the seats in the back. Thank you so much. Can the community of Tseng come forward, please, and occupy the front row? We did invite you earlier on that if anybody else wants to testify, you can come and see me or you can see Lottie.
So remember what so the number of the child John but
you can put your name down and then we'll call you. From the community of Tseng, there's 2 people who want to testify. Is there anybody else that wants to testify from this community that's not Lolo or Dune? Okay, thank you very much. Lolo, Paddy.
My name is Lushana Lopani from Tibet Kwapa. I utilize 2 clinics, Namadi Clinic, the Sakamoto Clinic, and Sakamoto Clinic. I did 28th April 2015. On the 28th of April 2015, to the Gaya Clinic in Namahadi. I went to Namahadi Clinic. After I'd been checked up and I was sent off to the pharmacy. After I procured my medication, it came to my attention that my pills are not. All perfect. They know why my pills, not all of them here. House, and then he decided to call the house. Like a reference number, got a reference number. After 2 days, like a phone area district manager. We got a call from the area district manager. For her name is Leonard. The lady told me that the department has been encountering problems from December, but she promised that he will receive his full treatment. The area district manager has said that he goes to Elizabeth Trust Hospital so that he can get his treatment from there. It took him his money out of his product to get the medication. The next month when he went to get his treatment, still the same problem. He tried to ask what's the problem, why am I not getting my full medication? To no response. He left. When he came the following day, he went to the pharmacy. He tried looking at other patients' files to see what's really going on. They come from a very rural area. Most of the people that use the medical services, most of them are illiterate people. O/S. Their files was written 0/O/S. Clinic 0/S. When the parents go to the clinic and the nurses see that 0/S, it means that the pills are outstanding, they are read out. The pharmacist doesn't tell the people that the pills are they always drink half their medicine, they don't get half. They have full medication. April 2015, on the 22nd of April 2015, he went to Manaba Hospital. He reported to the receptionist. It took him 3 hours just waiting for his file. No one came to help him. No one came to tell him. There were little children there that he could perceive from where he was standing out there trained. From the time that he was sitting, they would literally be on a computer, all 5 of them. Complain to Ms. Skosana. Chronic severe peripheral neuropathy. When this file came to him, he has that chronic severe neuropathy that he just said. He was very shocked that in his file, that only what was recorded in his file as his condition is just a broken arm. His medical history was not written down. Anything, no medical history. He took the file with the broken arm, orthopedic. Went to the orthopedics. He was sitting in there for 6 hours. He was there with the people who also came for problems with their arms and something else. Some of them lose their arms and legs. When the doctor came, it was past 4. He looked like a person who just got out of theater because he was dressed in such a manner. And he asked, where does the queue start from? I've never been so hurt in my life. To see people as old as my mother, that they had to lift up their dresses to show him their problem. Change each and every one of them in the corridors of the hospital. On the 7th of April this year, we booked an ambulance that was supposed to transport us from Manabo to Bethlehem. When we got to Bethlehem, it was 7 o'clock, as in accordance with our appointments. It hit 8 right across until 11. Nobody attended to us and told us what's really going on. The ambulance driver told us to get in. He never told us what delayed him. And while we were still conversating in the ambulance, the ambulance just came from Warren as well. Harry Smith. Tia. And he had to take us from there. And we didn't go to a destination. We still had to go to Kesto. When we arrived at Kesto, upon arrival at Bethlehem, I switched ways with the doctor that was supposed to see. And then my trip was in vain. Last month, Last month I was put in ambulance. The one that transports patients from Kwakwa to Bloemfontein. Then I had a problem severe chronic peripheral neuropathic control. Just the problem that he has just stated. It's very sensitive to coldness. They sleep on the chairs all night. And when they sleep there, they leave only in the morning. They had various problems. So while they were sitting there, two security guards came. They had a heater and the extension. And the extension cord. And then he thought security guards have the heater for us. They joined it, they took off their shoes, and they were sitting on the heater. We stood there out in the cold all night. Past 2 midnight. They woke up. They took the occurrence book and they wrote and then they said comfortably and slept. From the way they slept, it was very amazing. Because he managed to open the occurrence book, they are all in good condition. And it was written all in good condition. July. On the 3rd of July, they said, people of Bethlehem. He went to people of Bethlehem Hospital. They were traveling with the patient's agents. It was very cold that day. And then he asked other patients, why did they bring the scarf for us? And other patients told him that we used to this life. When he goes to Bethlehem, when you ask the driver, where's the heater, can't you promote the driver? The driver tells me we have to take this car in for service in Bloemfontein. When it takes people to go to Bloemfontein, when they ask why isn't the heater fixed for us, they tell him that we have to take in the car for service at Belco. The story of that car. Whilst we're still being transported with a car that's not in a good condition, I was with some lady in that car. And then we requested, please stop, we need to pee and buy food as well. The driver was a lady. We were stuck in that car, the door couldn't be opened for us. I was so surprised with this to call a stranger that was passing that please and he wondered if the key was given to the wrong person. This means that this person was to try to look at us and take us where we don't know. But then it got to attention that this guy was in the control room. That's why he didn't help. There's another clinic that he attends. It's called Skamutu Clinic. Clinic in very, very deep in rural area. That clinic is deep within the rural areas. They have a problem with the clinic. There's a box written complaints. You write in the box until you get weary. You never know when it's open, case that there is running, when the case has been heard, or the sad thing about this clinic is on a Friday at 12 o'clock it closes. It doesn't register people. They have a training. Every Friday at 12. We don't know what's going on with this training. This clinic, just like any other clinic, it has an admin office. It has an admin office. Where our files as patients are in there. The security officer being handled by security officer registers as volunteers in the admin office also register us. And then sometimes even the patients are being asked to help in the admin office. And then just as I'm about to conclude, just come to clinic if it's a mother and child on a Friday, they look at the mother. The child will come on a Monday. You hear for a clinic or a clinic inside the clinic. The nurses come to clinic. The nurses then come to clinic. Against their name badge. They've never seen images with a name badge or name tag. Name tag. They call them their nicknames. They call them Osmabatu or Bogi. They don't really know their names. Yesterday, as he was about to come to Prefecture, because he has a desk. He went to the clinic to just ask for a number so he can call when he's in Bloemfontein. Yes. Just to ask for a telephone number for the state clinic manager. You must go and state to the clinic manager, why do you need the clinic number? I went there, and then he gave phone number. I wondered if they failed to just give me a clinic telephone number. If you want to maybe discuss the clinical records with them, will they permit that? Come to clinic was the clinic that he started off with. By that time, city count is a 49. The city 4 count was of 49. His parents transported him. CHW. There was a community health care worker at that time was called Emasconian. He cared for him from that time up until now. When the field manager gave him Emasconian, the field manager told him, this is the right person to take care of you, she'll band you and do everything for you. He's surprised and also said, he's wondering if she got him or, they terminated a contract. He's just wondering what's the position. The same thing is with she's still caring for with our relationship with the daughter. She has a better relationship. He feels comfortable with the community with the doctor, and he feels really he's very comfortable with the lady. And then up until to this day, no one can give you a valid reason as to why that lady is no longer there working. The Tibetan clinic has tremendous problems. It's within the society of people who are suffering. After the establishment, they stopped abusing people. Protest people within the boundaries. We always ask these people, take them, record them with yourself. But in the area which you live in, many households don't even have a cell phone. And they also intimidate them. As I'm speaking now, whatever we say now is there with them, they know. He doesn't know what they are. And he can repeat. So right now, whatever that he's saying is there. But he's not surprised because after the occasion that just occurred, now he saw something. He saw his neighbor, sent a message, saying Hebrew. Somebody's telling that person that you and after he walked out, then what occurred. We'll fight for the community. No matter come here, nothing will shut our mouth.
Thank you, Tatekali.
Thank you, Tatekali.
We're going to invite Mayor Deleo. Okay. We're going to invite Mayor Mofokeng. Thank you.
Greetings, everyone. I'd like to greet everyone. My name is During the days of Mary Kidireko, I was one of her patients, and she checked me regularly, and I had TB for 8 months. I wasn't coughing very much. And it was discovered through an X-ray. And they discovered that my lungs were filled with water. The water was drained out. And right, the yellow water was drained. And that was when my TB was discovered. And I had to live off medication. I took my meds for 8 months. And I recovered. That's when I realized that you can actually recover from TB. After I recovered, I decided to go and volunteer so that I can help people in the community as me. I was able to tell them that they need to eat vegetables and not eat too much meat and drink milk. and porridge in the morning. But our patients were able to heal. The pain we experienced as CHWs, we got a letter saying we had to stay at home for a while. And we were never until now. What hurt me most is that during that time, our patients couldn't open up their mouth and take their medication. We had to force the pills clean their mouths and then break down the pills so that they could be able to survive. And they were able to take their medication. They were able to get and walk again. Some of them have healed because we got used to the fact that we had to. I saw Memata, which was while our sister said to check her. One of our patients got worms out of her buttocks. The worms fell off one with bathing her. And we asked the sister what to do. And she said we had to bring the worm. They wouldn't even be able to look at the worms. The worms continued to flow out until the patient lost their lives. Our lives as home based care workers weren't at risk. We had problems because we were working in dangerous areas. We walked through trees. When I got to my patient, when I got to the patient, she would say that she's had and they had. Those are the problems we're facing. I complained and told my nurse and said that she'd give me another one to go with because and then I was assigned Memasconia. When we got there, Memasconia knocked on the door. And the door was open. The patient had and put a scissor on the bed. And found we got into the house of Memasconia to what was to occur to one of us. When Memasconia entered, she saw him behind the door and asked him why he was hiding. And he said that he didn't know they were knocking. She asked about the scissor, and he said he was just lying there. They required him to take his medication, and they did so. And they left. They told the sisters at the clinic how her condition was. And they told the sisters that their lives were in danger, so they wouldn't go there. And the sister said they should be and they should not go back there. They were hurt because they are used to bathing patients who can't walk. Re a ba jesa.
They
Re ba tshwere eo.
they do everything for them.
Empa tjhelete yona ha eyo.
But they get nothing.
Ho re ka ba ka qetela ho bua bohloko ba bona o so etswe ho tloha community.
So they were ahead and were told they were going to be part of the community.
Se re tla sebedisana ka bona. Ba ba ka mora di-salary, ho ke tseo se di feditse.
After they filled forms to get their salaries, they were told that the forms applications had failed.
Ba tla sa di.
And said they were never going to be raised.
Re tla tlameha di bue hape.
Then have to sit at home.
Hodimo ha rona ka June moo, batho ba rona ba ile ba utlwa bohlokwana.
Us being retrenched had a negative impact
Ba re bonele re thusitse hakaana.
on our patients, and they think that they.
Jwale le yelang hae.
Why are you guys going home?
Ra re tlo kgutla.
And we gave them hope that we were going to come back.
Empa re tseba ke ba ba ho kgutla.
But we don't know when.
Ka June eo e neng re phomotse ka yona.
In June, when we got retrenched.
By 16 ha re tlameha re fumane tjhelete ya
On
rona.
the 16th, when it's supposed to
Se re thusa ho ba February, March, re ntse re sa thole tjhelete.
it was 3 months.
Ntse re sa e thole tjhelete ya
We
rona.
were getting paid.
Ke moo re jowang tjhelete ya rona.
That's when our money was eaten.
Ya ba ho fuwa 2,100, 1,203.
And we only got the same amount
Ya ba re sa e thotseng.
and never got the rest
Jela yona.
until today. Thank you.
Thank you very much. I think there's some bits that you might say that may have been missed during the translation, because I think you're speaking a little bit fast. And Johnny, can you just help us with that?
There was something about working conditions. I don't know if you remember. She had a big chunk and everyone got, and we didn't get anything. Or something she started talking about the dangerous areas, and then it just kept going.
She claims that where the area where she works in is very dangerous. She can't, they have to walk long distances through bushes, and it's very dangerous for them. Even got to a point where the patients themselves were a bit dangerous. As they required sexual intercourse before they would actually let them give them their hands.
We're going to hand over to the panel.
Once more, thank you very much for sharing the availability of gas to the problem. But I think what we had here for the first time is somebody to share with us the plight of contract workers. The plight of contract workers.
With the healthcare workers facilitating it.
And also clearly articulating the role of community workers in the community. They heard very loudly. And again, it is about the system as a whole. How is it working? Thank you.
Thank you very much to the community of the same. Can we get the community of Bradford to come forward, please? Bradford.
occupy the front row. Okay, thank you very much for the community of Bradford. We're going to continue with that. Okay, sorry, you need to speak with 2 minutes. We're just waiting for one of our hands. Thank you. We're going to proceed now. We're going to invite Malebabo Boy.
Malebabo Boy.
Malebabo Boy. The reason why I like Malebabo Boy,
Malebabo. I felt and they discovered that I had TB and no communication. I took my treatment from Malanta Clinic in Bradford.
Yeah.
Shaky and violently people come to my clinics and halfway so that they can exchange the patients. On the way, an ambulance drove into a pothole and something had broken down.
Then I
found myself jumping from the back to the front. I don't know how that happened.
But I thought it
was a minor mistake. After the exchange of ambulances on the way,